With its 16 locations, the Ljubljana Community Health Center is Slovenia's biggest public health institution, providing primary health care to the population of the capital Ljubljana and beyond. We provide care to close to 500,000 of registered patients, contributing to more than 2.8 million visits a year. At the entrances to community health centers, triage areas were established already in February. Here, healthcare professionals direct patients and make sure there are appropriate numbers of service users who can be in the unit at the same time. Despite this, patient zero emerged on March 4, 2020. Regardless of all the procedures, he managed to enter the waiting room area, and it was found later that he tested positive for the new coronavirus.
Ne zaupaš najprej na začetku temu izvidu, da je to dejansko res, da je to tisto primerno. Pa začneš razmišljati v bistvu, kaj vse si ti naredil takrat, ko si pristopil do pacienta, si sploh imel masko, si razkužil roke, koliko ljudi je bilo takrat v tisti čakalnici, koliko zaposlenih je bilo zaradi tega izpostavljenih, en cel kup skrbi se pol sproži.
With the outbreak of COVID-19 in Slovenia, we had to address a comprehensive reorganization of our existing operations. Even before the first case was reported, Slovenia monitored the situation in China and in the neighboring Italy. We tested in practice our contingency plan for infectious disease pandemics. As the infection spread in our immediate neighborhood, we immediately set up the crisis headquarters consisting of the extended management, representatives from infection control related to healthcare, a nurse representative, and PR services, which meets at least twice a week.
When organizing work during the epidemic, it is crucial from a professional point of view to ensure rational use of personal protective equipment, rational allocation of human resources, good provision of information to employees in terms of rapid transmission of information, coordinated action of department heads with management, and clear management guidance to keep employees and patients feel safe despite the uncertainty of the situation during the epidemic.
The professional management of the institution and of the crisis headquarters translate into working 24/7. It means that one is devoid of one's own wishes and lacks leisure time. Also, one cannot devote time to all the little details, making treatment easier for patients and employees. The permanent teams of coordinators were appointed. They are tasked with work organization by areas. It is essential that the team is permanent, and a 24-hour call center was set up as well. The call center was designed to raise awareness about proper preventive measures and to ensure continuous availability for the population in case they have doubts or questions. Appropriate personal protective equipment provides a basis for the safe work of our employees.
Making sure that enough personal safety equipment is available during times of epidemic is a very big challenge.
The Commission for Prevention and Control of Healthcare-Associated Infections focused its activities on the immediate education of employees, the provision of personal protective equipment, isolation facilities, and the preparation of entry points for testing and supporting documents such as working instructions and reminders.
At the level of Slovenia, taking swabs for the new coronavirus is concentrated to 16 entry points. The entry point of the Ljubljana Community Health Center, as the biggest entry point, covers almost 1/4 of the population in the country. Patients cannot come to the entry point for taking swabs unannounced, but are referred there by their general practitioner or the on-call doctor following telephone triage. The so-called drive-in system was introduced so as to accelerate taking swab samples, thereby greatly improving patient flows and the number of swabs taken.
Work at entry point has been perfectly organized from the very start. High level of personal protective equipment is being provided. Working in all weather conditions is a particular challenge. However, due to team's great dedication, work runs smoothly through all the day.
Our units were separated into infectious and non-infectious part. Patients at risk who do not have COVID-19 suspected symptoms are scheduled for an appointment taking place in the centralized clinic for non-infectious patients.
We have pediatrics offices for well child visits with separate entrance so that infective children don't mix with the healthy ones.
A day before examination, the nurse calls the patients and checks if everyone at home is healthy. The child is scheduled for an appointment accompanied by only one parent, provided that all family members are healthy. The work is organized in such a way that the patients do not meet while the rooms are duly cleaned and ventilated. A patient who believes that she has to be examined first calls the clinic of his or her GP. If the doctor, after conducting telephone triage, estimates that the examination is needed, the patient gets an appointment. Upon entering the community health center, the patient receives a surgical mask in the triage area and disinfects hands. The persons without the appointment cannot enter the community health center. Healthcare professionals have a demanding task in this period. Most treatments are delivered with telemedicine. Patients send the photos of medical condition symptoms and via the phone present medical history and measurements. Phone replies do not allow for touching and seeing the patients, who often express through body language what cannot be uttered in words. Hence, the doctor always doubts if the right decision was made.
Professional judgment is much more difficult under these circumstances. We want to protect healthy patients from being infected with new coronavirus. That is why we choose long-distance treatment as often as possible, even if it means prescribing antibiotic without clinical examination.
We needed another strategy. We needed to organize common COVID unit, which first started operating on 16th of March. Doing this, we had two goals in mind. We wanted to make sure that infective patients don't mix with healthy ones, and we wanted to optimize the use of personal protective equipment.
We set up the entry point for the examination and treatment of patients with suspected coronavirus for the patients coming from the central Slovenia region, which in total means 575,400 patients from the Ljubljana Community Health Center and 7 other community health centers, as well as all concession holders in these regions. The COVID screening clinic separately treats adults and children. This clinic is not designed for examinations of all acutely ill patients, but only for those where the GP estimated that monitoring via the phone was no longer safe. Patients receive a scheduled appointment over the phone. Once they are in front of the clinic, they ring the bell at the entrance and wait for the nurse to open. At the entrance of the community health center, they receive a mask, then enter the clinic and give the health insurance card to the nurse. Upon the examination in the COVID clinic, the physician determines the patient's clinical condition, runs different investigations and laboratory diagnostics. If blood collection is required, it is performed by an adequately protected lab worker. Following the examination of the patient, the physician estimates whether referral to a hospital is needed or if the patient can stay at home, and telemedicine is performed. The work organization protocol has been drafted for activities in the COVID clinic. Employees also follow instructions with regard to dressing and undressing of personal protective equipment. After working in the COVID screening clinic, it is very difficult to go home to one's family, young children, grandparents, while knowing that there is at least a theoretical chance we could be infected. As for general continuous emergency medical care in the Ljubljana Community Health Center, we immediately started adapting our work organization to the epidemiological situation both at the emergency unit as well as in the field. A swab is taken from all the patients with suspected COVID-19 before entering the emergency unit. We also had to adapt the provision of emergency medical care in the field. The emergency medicine team puts on personal protective equipment already before entering the ambulance or before departing for intervention.
For the time of the epidemic, an additional team has been set up at the General Emergency Department CECHC Ljubljana, dedicated to home visits of immobile patients with suspected or confirmed COVID infection. The healthcare professional team examines such a patient and provides them healthcare at their home.
House calls are centralized for all patients in need of such care. If necessary, when examining the patient at home, a swab is taken as well. The majority of patients stay in home care. In the case of a relevant indication, such as, for example, a chronic wound, decubitus, patients at home are visited by community nurses who enter people's homes in the period when social contacts are prohibited. Hence, the patients at home are even more vulnerable and exposed. Particular attention should be paid to the most vulnerable population in social security institutions.
Several doctors' offices of the Community Healthcare Center Ljubljana are operating within retirement homes. The first cases of COVID also appeared in the retirement home Bukalci. This is where we organized a department for COVID-positive residents.
In case of the infection, care recipients are divided into 3 separate zones: infectious, a gray zone occupied by residents with suspected COVID-19, and non-infectious. Due to the shortage of healthcare professionals following COVID-19 infection, teams from the hospital level have also been involved in the care of COVID-19 residents. An individual treatment plan is prepared for every care recipient. We centralized all the activities, reduced the number of direct contacts with patients, separated and centralized the treatment of infectious and non-infectious patients in need of a medical examination. In this way, the spread of the infectious disease both among the general population as well as among healthcare professionals is limited to the maximum. In our premises, the entry point for emergency dental medical treatment of the wider Ljubljana region, which is one of 7 at the national level and covers the largest share of the population, came into operation. Patients are scheduled for an appointment by their chosen dentist following telephone triage via the call center. Clinics have been refurbished according to work needs and a highly infectious environment. Throughout the work process, the areas are protected by way of compresses. All the instruments are individually packed and sterilized. All devices and instruments, which are not absolutely necessary, were removed from clinics.
The organization of an entry point is a living system which requires constant adaptation to the needs of patients, healthcare professionals, as well as equipment. For this reason, we decided for the organizers to be present at all times.
During difficult and demanding times, such as this epidemic, appropriate attention has to be devoted to the employees when they encounter fear, helplessness, and different circumstances. It is therefore important that our associates are equipped with relevant skills and tools.
Rada bi pa starše videla, ki jih nisem videla že cel mesec, ki oba dva sta starejša, sta bolna, niti ne potrebujem morja, potrebujem ljudi, do katerih ne morem zdaj.
Čakaš, da boš ali zbolel, pač nekak tisti strah te skozi malo gnjavi. No?
Moja mami ni v redu in imam en tak občutek, da občutek krivde, da me ni tam zraven.
Vsekakor bi z veseljem šla domov. Taka je situacija.
The Primary Healthcare Research and Development Institute within the Simulation Center organized training by means of simulations in relation to the correct taking of swab samples, efficient communication during the epidemiological situation with users and employees, and the demonstration of correct use of protective equipment. The changed operation of primary healthcare impacts the provision of care to patients and the well-being of healthcare professionals.
Education using simulations in healthcare is very important, especially when talking about intervention that we do not do every day. And we don't have epidemic every day, we don't take swabs every day, and we don't have crisis communication every day. These are interventions that simulations in healthcare make sure we stay competent in, and it makes our practice more safe.
We monitor our services, record our own actions and track the data that will help us analyze what could be done in a different and better way in similar situations in the future.
We plan to examine the views of professionals with regard to changes in work organization and the operation of family medicine outpatient clinics. We are going to compare the situation before, during, and after the epidemic, elaborate the model of future measures, exchange the results, and also compare them internationally.
Research provides insight into a changed functioning of primary health care during the epidemic. This enables us to design a model that provides quality patient care in similar situations in the future.
Good cooperation with the local community is of the utmost importance in the current situation. Hence, our sincere gratitude goes to all the people as they recognize the seriousness of the epidemiological situation. They cooperate with us and in the process demonstrate different forms of help to make our work easier. In tackling the demanding epidemiological situation, we have been greatly assisted by the civil protection of the City Municipality of Ljubljana. The City Municipality of Ljubljana facilitates our work process by providing us additional space and arranging free parking in the vicinity of the Community Health Center, thereby improving the availability of healthcare and the treatment at the entry point.
Only collaboration is the key to success, and we have succeeded.
With this documentary film, we looked back for the future. Surely, a similar story awaits us, and then it will be easier. The epidemiological situation demanded new organizational measures and many adjustments, and at the same time, it brought us closer together.
Running such an institution means being constantly available to all employees, reporters, and decision makers. This brings changes to our daily routines, changes to our lives. But from the complexity of this situation, one must take out those elements which can ease our work for the future.